Can activity-dependent plasticity improve stroke rehab? Can activity-dependent plasticity really enhance stroke rehabilitation? The answer is yes. This fascinating process can significantly aid recovery by promoting the brain's ability to reorganize itself after a stroke. When a stroke occurs, certain areas of the brain may be damaged. However, the brain has a remarkable capacity to adapt and form new connections, especially when we actively engage in rehabilitation exercises. Neuroplasticity is the term used to describe the brain's ability to change and adapt. After a stroke, other parts of the brain can sometimes take over the functions of the damaged areas. This is particularly effective when driven by purposeful activities. Activity-dependent plasticity specifically refers to the changes in neural circuits that happen when we actively use and practice motor skills. This practice can help reinforce weakened connections and promote recovery. Research supports the idea that combining rehabilitation therapies that encourage voluntary movement can enhance motor recovery. One important process involved is Hebbian plasticity, which states that when neurons are activated simultaneously, their connections become stronger. Timing and synchronization of therapies with voluntary activity are essential to maximize these benefits. For instance, repetitive training of the affected limb, often paired with aerobic exercise or enriched environments, can help the brain be more receptive to positive changes during the early recovery phase. It is also crucial to consider homeostatic metaplasticity, which stabilizes neural circuit activity. This means that the brain's response to rehabilitation can be optimized by carefully planning the type, timing, and intensity of activity-based interventions. However, not all forms of plasticity are beneficial. Maladaptive plasticity can lead to inefficient movement patterns or abnormal neural reorganization, which may hinder recovery. Therefore, rehabilitation strategies should focus on promoting adaptive plasticity through well-designed, task-specific, and intensive training programs. In clinical practice, many evidence-based stroke rehabilitation methods relying on activity-dependent plasticity. Techniques such as constraint-induced movement therapy, repetitive task training, and aerobic exercise combined with motor practice have been shown to improve motor function by encouraging the brain to reorganize itself in a beneficial way. In summary, activity-dependent plasticity plays a vital role in effective stroke rehabilitation. By designing therapies that actively engage the affected neural circuits in a timely and task-specific manner, we can enhance neural reorganization and improve functional recovery. This approach aligns with current scientific understanding and established rehabilitation principles, underscoring the importance of personalized, intensive, and activity-focused therapy after a stroke. Always consult healthcare professionals for tailored advice and treatment options.